Hello, folks. My name is Rodrigo. I'm one of the students of Health Science Education. I'm here to present the alternative future and the leads framework for an academic anesthesia scenario. Uh, to start with, just a quick introduction. As we know, modern healthcare systems, they are complex and they are continuously interacting with external forces. This interaction is a way difficult to predict. So future healthcare managers, they need to know how to manage these variations in an ongoing basis. So Michael G. D. Groove Health Leadership Academy did a literature review along with a dialogue with stakeholders, trying to find the best answer to what future healthcare leaders should focus on to prepare for changes. So in this study, they were able to identify healthcare external forces of change and anticipating the needs that a healthcare leader will need to have in order to manage those changes. In this study, they were able to create this SEEPT framework. So they categorize all the external forces of change in 5 items: social, economic, environmental, politics, and technological. And through this, the analysis of this framework, they created alternative healthcare scenarios. So the future scenario that I decided to present is the scenario 1, entitled as slow incremental reform and better health. The external forces of change mainly is the political, followed by economic and technological, and lastly, social and environmental changes. I'm gonna talk the 3 main ones for this scenario specifically. Starting with the political. We're gonna have the influence over the lifestyles. So it's gonna be a directly influence over the population. Political also is gonna talk about the orange of the governance, mainly the different policy levels, like national versus local. Political also talks about the forces, the public funding allocation, and talk about regulation, fiscal policy, incentives, and public education campaigns, that all of them gonna have an influence in individuals and organizations. And talks about globalization with the participation of different countries and the trends to regionalization to empower regional organization and networks. It's always good to mention that Canada is a publicly administration single payer system, and within this scenario, this is going to suffer a change. Following in the external drivers of change, the economic, we talk about the GPA growth per year, and also about the resource availability, human, natural, and technological, and the income equality, and how these 3 economic drivers can influence health. Technological, I talk about the health innovation systems, talk about the access of information, mainly with digital data and the shared information. And we're going to talk about precision medicine, especially with genomics, to predict, prevent, and treat some health conditions. Big data and artificial intelligence. They can, in the individual way, can help with disease detection and diagnosis, empower the individuals to make their own life choices. And in a more bigger way, in the system way, we can predict the population needs and inform the health system plan. And we also can have more transparency of provided outcomes that can guide some improvements. And lastly, in the technological, we have the Internet of Things. It's the devices that are capable of collecting and analyzing clinical information. And we can use the Internet of Things, associate them with remote care, like video conference, and use that to take better care of remote communities. So scenario one started with an increase in the medical cost, mainly because the growing and aging population and the increased cost of the new medical devices. The province is going to have a change, a shift to capitation and bundle payment schemes. And as a result, we're going to have a variation of healthcare effectiveness among the population. In the population, we're going to have very slow health improvements, and Canada is going to have a slower improvement compared to the other first world countries. Because of that, health will become a main political issue, and questions like how has the reform of healthcare failed to improve the country's health, and how to slow the growth of health costs. So the new data from the technological changes we're going to use to do new studies. And these new studies, the results, we're going to have an enhance in the health system performance and a new wave of healthcare performance, of healthcare reform is going to happen with an emphasis in non-medical elements of health, like prevention and population health. This focus on prevention is going to have with risk behavior management, social network, pre-disease identification, data, and new cure. As a result of that, we're going to increase the population's self-care and health knowledge, decreasing the demand for medical care, and creating a high growth market for innovative health products. With this increased market of innovative healthcare products, we're going to have the rise of new treatments and emergency science that will ultimately provide new cures and decrease the progress of some disease. And the enhanced use of technology is going to increase the dissemination of health innovations. So a new public debate is going to happen, talking about the population with poor health habits or genetic predisposition to some disease. They are going to be responsible to the increase of the medical cost. With that, we're going to have a social pressure on the population on health responsibility and target service to vulnerable people such as elderly and patients with chronic disease is going to happen, aiming to prevent hospitalization and to reduce the medical cost. Thinking about this scenario in an anesthesia perspective, thinking about the political drivers of change, the public educational campaigns with help, we are going to have healthier habits population. It's going to decrease the amount of comorbidities, and this can interfere the anesthesia care because healthier individuals can potentially decrease the length of the hospital stay and also decrease the medical cost. Thinking about economic drivers of change, the globalization in the anesthesia scenario, new practice and new techniques can be learned, and with a more efficient anesthesia care, reducing the anesthesia cost. And for the technological drivers of change, the big data I believe is going to be the biggest driver of change, especially with the access of the anesthesia records. And we can easily have access for them and to know what should we do to reach better outcomes. Also, some of the anesthesia consults, mainly the pre-anesthesia consult, can be all done in a remote way. So urbanistic is going to be a change. And the new devices such as ultrasound, anesthesia depth monitors can increase the medical cost in the beginning, but they're also gonna reach better outcomes with them. The LEADS framework, it's focused in the human element, that the people who shape, work, and use the healthcare system will drive the changes through the influence of external forces. So the healthcare leaders they need to have a transformative leadership, focus on understanding these forces of change, being comfortable in working with uncertainty, having a proactive approach, create and strengthen a culture that drives changes, and also share the commitment and the collaboration among all stakeholders. The LEADS framework is divided in 5 items. So lead self, engage others, active results, develop coalitions, and system transformation. And the leads for the healthcare leaders, it is important to help with decision making, policy development, and the implementation of new systems. Thinking about the LEADS framework in an anesthesia perspective, I'm going to talk about the 5 items. So LEADS itself, it's to be updated in all anesthesia devices, recognize the areas that the lead needs improvement, and access more training, be updated, and also be an example with constant attitudes. Engage the others, it's to create a strong social connection, engage in the development of all anesthesia department, to create a strong vision and motivate education, and ensure the involvement of the anesthesia members in healthcare changes. To achieve results, set clear goals for the anesthesia department, assess outcomes through quality improvement projects, and share data with all the stakeholders and plan for the changes based on the results of the data. And develop coalitions to integrate all different OR teams, to propose partnership with a globalization focus, to implement up-to-date anesthesia programs for residency and fellowship programs. And lastly, the system transformation, support and provide training for new technologies, and also to publicize the importance of those new technologies in the anesthesia settings. In my opinion, the advantages of the LEADS framework, the LEAD framework had a good face validity because it's very intuitive for the leaders to understand the framework, and it's very people-centered leadership. The disadvantage, in my opinion, the framework has a big focus on the leader, in one leader. So I think the framework should explore the relation between different leaders of healthcare system. The framework is supposed to be used in a transformative leadership focus, and with that all external factors of change, sometimes we need other types of leadership in the healthcare system. And with all those changes, will be this framework sufficient for the future? With artificial intelligence, big data, will be the framework enough? And how to address all those changes in the leadership? For next step, as an anesthesiologist in academic position, I believe that this framework should be shared with the whole department. I think to have to access the satisfaction of the anesthesia department and conduct quality improvement programs to mainly study the outcomes that we are having in our practice today. Also have an annual review of the anesthesia programs and to be up to date with all new devices, and to practice distribute leadership, to involve all the anesthesia department in all changes needed. Those were my reference. Thanks for your time. Hope you like it.